Welcome everyone to the Star Health Insurance YouTube channel. Hi, I'm Dr. Jayad Pawar, your bariatric and robotic surgeon. Today we are diving into an important and often misunderstood topic, bariatric surgery. We will break down the types of surgery, benefits, myths, and answer to the key question. Is weight loss surgery for you? Let's get started. In this video, we will talk about what is bariatric surgery, is weight loss surgery for you, how does obesity surgery work, what are the types of bariatric surgery, and what is hospital stay and recovery, and the benefits of bariatric surgery, and what is the expected weight loss after the surgery, and finally, what are the myths about bariatric surgery. Bariatric surgery, also known as weight loss surgery or metabolic surgery, is a set of surgical procedures performed on the stomach and intestines to help with people with severe obesity to lose weight and improve their health and well-being. So bariatric surgery can be a very effective way to lose weight and improve health. However, it is important to note that it is not a quick fix. It requires a lot of commitment and effort on the part of patient to be successful. If you are considering bariatric surgery, it is important to talk to your doctor and about the risks and benefits. You should also be prepared to make some lifestyle changes such as eating a healthy diet and exercising regularly. Is weight loss surgery for you? Are you the right candidate? So according to an internationally accepted criteria, the indications for obesity surgery are BMI more than 40 or BMI more than 35 with pronounced comorbidities such as diabetes, hypertension, PCOD, thyroid problems, or excessive snoring, what we call as sleep apnea, or infertility. Or if you had many attempts at weight reduction under the guidance of a physician over a period of 6 months to 1 year and still couldn't achieve weight loss, then yes, obesity surgery could be for you. So what does obesity surgery do? It works on simple principles that reduces your food intake and calorie intake. It reduces the hormones which are responsible for sweet cravings, food cravings, and eventually helps to lose weight. They help in resolution of up to 90% of excessive weight loss and almost similar resolution of comorbidities such as diabetes, hypertension, cholesterol, infertility, thus making it as the most successful and effective way so far for morbid obesity. So what are the types of surgery? So the most commonly performed is the gastric bypass. It involves creating a small pouch from the stomach and connecting it to the small intestine, bypassing a significant portion of stomach and small intestine. This not only limits the amount of food you can eat, but it also affects the hormones related to hunger. So the next procedure is sleeve gastrectomy. In this procedure, about 80% of the stomach is removed, leaving a narrow tube or sleeve like a banana. This significantly reduces the stomach's capacity and also affects hormonal regulation of hunger. So another procedure is adjustable gastric band. This involves placing a band around the upper part of the stomach to create a small pouch. The band can be adjusted to control food intake. However, it's less common now due to lower long-term success rates compared to other procedures. Now, how long will I have to stay in the hospital? For about 2 to 3 days will be hospital stay, and during which you will be advised about the diet to consume, and you'll also be provided with a diet chart. Now, what are the benefits of bariatric surgery? The most important, weight loss. So most patients lose a significant amount of weight, often about 50 to 70% of their excessive weight, and improved health, improved blood sugar control, reduced risk of heart disease, reduced risk of stroke, and improved sleep quality, reduced risk of certain types of cancer, and of course, enhanced quality of life. So weight loss can lead to increased mobility, better mental health, and also improved self-esteem. Now, how much is the expected weight loss? So average, a patient loses about 2/3 of their excess body weight in the first 12 to 18 months after the surgery. So bariatric surgery can be a transformative option for individuals struggling with obesity, but it's essential to understand the commitment involved. Consulting with bariatric surgeons can help to determine if it's the right choice for you. Now let's debunk some common myths about bariatric surgery. The most common myth, people often feel like it's their fault and they should be able to lose weight on their own. But obesity is not just about overeating and lack of self-control. Obesity is a complex medical condition with metabolic changes that can sometimes make losing weight nearly impossible. So let's get to the myth 1. So weight loss surgeries are risky and unsafe. For most people, the risks of obesity are much greater than the risks of bariatric surgery. Studies report a nearly 90% reduction in premature death from all causes after surgical weight loss, as well as a dramatic drop in deadly diseases such as diabetes, hypertension, and cardiac diseases. And while every surgery comes with some risks, bariatric procedures are among the safest on the operating table. In fact, the mortality rate is about less than 0.1% of the commonly done procedures such as gallbladder removers and hip or knee replacements. Let's go to myth number 2. Are all weight loss surgeries the same? Well, no. All weight loss surgeries are tailored according to the individual patient and associated conditions based on age, food habits, BMI, etc. There are many approaches to weight loss surgery. In the early days, doctors often performed a gastric band surgery with sections of the stomach with an adjustable band. Surgeries have evolved from an open method to keyhole techniques which include both laparoscopic as well as robotic surgeries. Now, myth number 3. Bariatric surgery is all cosmetic. No. Obesity is linked with more than 40 health conditions, and weight loss surgery can help minimize the impact of all of them. In fact, up to 80% of the people with type 2 diabetes go into remission following bariatric surgery, meaning their blood sugars fall within the normal range and they can stop taking medication. Myth number 4. Bariatric surgery versus liposuction, the most common one. Liposuction is just a fat removing and contouring surgery at particular areas such as thigh, buttocks, etc. It is just a cosmetic surgery, whereas bariatric surgery is life-saving and a metabolic surgery. It involves altering body metabolism, enhancing uniform weight loss all over the body, and normalize metabolic activities of your body. Myth number 5. Bariatric surgery is for people who have hundreds of kgs to lose. Unfortunately, it's not true. Many people think weight loss surgery is not for them and it's only reserved for severely obese people. In reality, the people who benefit most from the surgery are not only obese, but they also have coexisting conditions that impact their health as well as quality of life. So if you have a BMI of 35 and you're taking medications for diabetes or high blood pressure, being treated for sleep apnea, or experiencing chronic low backache or knee pain due to excess pressure on the joints, you are probably a candidate for bariatric surgery. Myth number 6. You can't get pregnant after bariatric surgery. Not true. Post-bariatric surgery, women can still have healthy pregnancies. However, it's essential to wait for a specific period after surgery to allow your body to recover and stabilize. The optimum amount of time for conception will be recommended to you by bariatric surgeons. To safeguard the health of the mother and the unborn child, it is essential to keep a healthy diet throughout the pregnancy. Myth number 7. That surgery can disrupt normal body functions. Not true. The process by which bariatric surgery functions is by making changes in the digestive system to control the amount of food consumed or absorbed. After surgery, your digestive system may need to adjust a little, but most people recover well. To make sure you get the right nutrients, your bariatric surgeon will provide advice on dietary changes. Supplementing with vitamins and minerals could be required in some situations to make up for any possible deficiency. Myth number 8. Bariatric surgery leaves a big scar. No, gone are the concerns about large, lingering scars. Laparoscopically, a minimally invasive procedure with small incisions, modern bariatric surgery is done. This reduces the scar tissue and produces faint scars that disappear with time. Myth number 9. The surgery is a waste thing, you will regain weight again. Sorry. One of the most common questions bariatric patients ask is, will I regain my weight? Well, everyone considering bariatric surgery naturally has this concern. Statistics show that only 1 to 2% of the patients who meet the criteria for weight loss surgery are successful in losing their excess weight loss with diet, exercise, or medication alone. With weight loss surgery, 85% of the patients are successful in maintaining at least 50% excess weight loss. So that's it. Today we'll be exploring how weight loss actually occurs after bariatric surgery. Bariatric surgery is an effective procedure for individuals struggling with obesity, offering long-term weight loss by altering the way your body processes food. But surgery is just the beginning. Successful weight management also depends on nutrition, behavioral changes, and lifestyle adjustments. Let's take a closer look at how bariatric surgery works and what patients can do to ensure sustained weight loss post-surgery. So on what principles does bariatric surgery work? The foundation of bariatric surgery lies in reducing food intake, limiting the absorption of nutrients in stomach as well as intestines. So normally the digestion process begins in the mouth where food is chewed and mixed with saliva and enzymes. The food then travels to stomach where digestive juices break it down for further nutrient and calorie absorption. As food enters duodenum, it mixes with bile and pancreatic juices, just speeding up the digestion. However, bariatric surgery interrupts this process. The surgery is designed to alter digestion so that the food is neither broken down nor absorbed as efficiently. This reduction in nutrient and calorie absorption helps patients lose weight and lower the risk of obesity-related conditions. You can expect to lose a lot of weight. If you have a weight-related medical condition like type 2 diabetes or sleep apnea, even these conditions might improve. And almost all patients who get weight loss surgery, 95% of them say their quality of life has improved too. So what are the health benefits? After gastric bypass or certain types of weight loss surgery, the health benefits often happen soon. Snoring or sleep apnea is the first one to reduce drastically, followed by diabetes, which improves dramatically. The same might be true of high blood pressure, arthritis, sleep apnea, high cholesterol, and other conditions. So what are the lifestyle changes you will have to make? So along with the weight loss, lifestyle changes help in sustaining the weight loss, such as eat small and frequent meals. The small stomach created by weight loss surgery can hold only so much. Eating large meals can cause problems. Many people with obesity are binge eaters, so adapting to eat smaller meals can be a challenge. Doctors usually advise against drinking during meals because it can wash the food out of stomach too quickly and interfere with your feeling of fullness. Coming to exercises, it helps you keep the weight off, and it's often easier after weight loss surgery because losing weight will help your joints. If you are not active now, take it easy when you get started and gradually make it more challenging. Talk to your doctor about easy ways to begin. You may also benefit from working with a physical therapist or trainer. Many weight loss surgery centers offer programs to help people shift to a healthier lifestyle before as well as after weight loss surgery. So after surgery, several adjustments are recommended for sustained weight loss, and those are modifying eating habits. That is, post-surgery, patients are advised to make significant changes to their eating environment. That is, by preparing meals at home, estimating portion sizes in restaurants, and recognizing high-fat content in the menu items, which are the crucial steps. It's also important to reduce alcohol intake, eliminate smoking, and substitute high-calorie foods with low-calorie options. Next is the nutrition education. Nutrition management is essential after bariatric surgery, and family involvement plays a key role. The family members who shop and prepare food need to be educated about nutritional requirements. Educational programs that offer practical, relevant nutrition advice are the most successful in promoting healthy habits. Next is the behavioral techniques. Cognitive behavioral therapy techniques can help patients recognize triggers for overeating, address societal pressures related to obesity, and understand that occasionally dietary slip-ups doesn't mean failure. Techniques include eating scheduled meals, focusing on eating without distractions, and consuming meals in designated areas like dining room. Incorporating these methods can help maintain weight loss over the time. Then the nutritionally balanced hypocaloric diets. So after surgery, patients are encouraged to follow a hypocaloric diet consisting of same types of food they usually eat but in smaller portions. High protein, low carbohydrate diets are commonly recommended. These diets, rich in dietary fiber from vegetables and fruits, are beneficial because fiber can reduce energy intake and alter metabolism. Finally, counseling and psychotherapy services. Psychotherapy, whether individual or in groups, plays an important role in post-surgery weight management. However, individual therapy sessions can address personal reasons for overeating, and the results are generally better when motivation is reinforced. Ongoing counseling helps patients and maintain the mental and emotional support necessary to achieve long-term success in weight loss. So bariatric surgery offers a powerful tool in the fight against obesity, but it's only the first step towards lasting weight management. Success after surgery relies heavily on nutritional education, behavioral changes, and ongoing psychological support. By adopting healthier eating habits, following a balanced diet, and staying motivated throughout the therapy, patient can experience sustained weight loss and improved overall health. That's it for today, folks. If you found this video helpful, don't forget to like, share, comment, and subscribe to Star Health Insurance YouTube channel for more insights on healthcare and wellness. Thank you for watching and see you next time.